If you're on the diabetic cocktail, which is blood sugar, blood pressure, and cholesterol medication, here's how to never take it again. In this video, I'm going to show you why your doctor is wrong, why your medications aren't working and possibly hurting you and putting you in the pill for an ill model, and most importantly, what you can do about it. My name's Dr. Stephen Wander, and when I was about 13 years old, my grandparents took me out to lunch. And like any other normal 13-year-old kid, I was super excited for a meal. And it was my favorite, Chinese. But then, my grandmother laid out 13 pills. And I was like, what are all the pills for? And she said, well, the first one's for my sugar, the second one's for my pressure, the third one's for my cholesterol, the fourth one's for my thyroid, the fifth one's for the side effects of the first one, and the sixth one's for the side effects of the second one, and on and on. And after that lunch, I saw her health trajectory go downhill really quickly. Oral medication after oral medication, insulin, dialysis, amputation of her right foot, until about 2 months after that lunch, she was gone. Now, I was obviously too young to help her, but that incident had a lasting impression on me. And I made it my life mission to make sure that no one else suffered like my grandmother did. I've since learned how to reduce, prevent, and eliminate diabetes. Heck, I even wrote the book on it, Reverse Your Diabetes, Change Your Life. And I'm here to tell you, it's simple to reverse this disease, but not easy. And now I've helped people all over the world reduce and eliminate their diabetic diagnosis. Now, I've been helping patients since 1997, and pretty much everyone tells me the same story. Person gets their blood work done, the office calls them and say, hey, Mr. Jones, Mrs. Jones, the doctor needs to see you. And they go in, and eventually the doctor comes in and say, Mr. Jones, Mrs. Jones, you're diabetic. And they tell me before the doctor clicks the ink pen, they're giving them a script that begins with the letter M and ends with the letter N and sounds a whole lot like, that's right, Metformin. And then they get this great advice. Mr. Jones, Mrs. Jones, what you need to do is change your diet, lose weight, and exercise. Meanwhile, the doctor needs to lose 35 pounds. And they get no other information on, well, you want me to change my diet to what, doc? You want me to lose weight? How and how much? And you want me to exercise? What type of exercise? And unfortunately, that's how they're counseled for the rest of their life. So most of you don't know that there's actually 4 types of diabetes. There's type 1, which is not reversible. We're not going to talk about that now. Then there's type 2, which you think you are. Then there's type 3, which is called sugar brain, aka Alzheimer's. And then there's type 1.5, which means you have an autoimmune aspect to your case. Wouldn't it make sense to start your treatment plan off with the proper diagnosis? How many of you know? So it's very important to get the right diagnosis, because if you don't have the right diagnosis, how are you going to get the right treatment plan? So no matter what you've been told by your doctor, type 2 diabetes is preventable, treatable, and reversible. In fact, I've helped tens of thousands of patients just like you reduce and eliminate their medication, including insulin, lose weight without exercise, and most importantly, prevent the devastating complications from diabetes: heart attack, stroke, amputation, blindness. I saw my grandmother go through this, and I don't want anyone else to go through what I saw her go through. The truth is, there's several different strategies that you can implement for you to reduce and reverse your diabetes. But obviously, everyone is different, and there's not going to be one strategy that works the same for each person. That's why each person is going to need a different strategy. So I've put together a workshop which dives deep into all the different strategies that we use for our patients, and you're going to learn how they work and why they work and which ones might be the best ones for you. Now, I know that can sound a little bit daunting, and perhaps some of you are even a little skeptical. I totally get it. But if all you learned was one thing to help reduce your numbers and help the process of you starting to reverse your diabetes, what would that be worth to you? So click the link below, enter your details, and get instant access to my workshop. A word of warning though, If you're looking for the latest fad, the latest exercise regime or diet, or some special supplement that you read on the internet like cinnamon or bitter melon, this isn't what this is. This is based on research. Research that your doctor and Big Pharma doesn't want you to have at all. Why? Because you're too valuable in what we call the Customer for Life program. How long were you told to take these medications? That's right, for the rest of your life. So if you're looking for some type of fad, new thing, this is not for you. But if you are looking for a step-by-step proven strategy based specifically on you to start the process of reducing and eliminating your diabetes, then click on the link below, enter your information, and get instant access to my workshop. The God's honest truth is this: 99% of you diabetics don't have any symptoms. That's why they call diabetes what? The blank killer, the silent killer. And so the truth of the matter is, since you don't have any symptoms, sometimes it's difficult for people to make lifestyle changes to get healthy. I totally get it. It's also important that 99% of you are on prescription medications that have very undesirable side effects. Heck, there's even one that just was proven to increase your risk for amputation by 50%. So let me ask you this: why is it that you want to be diabetic? Do you have kids? Do you have grandkids that you want to see grow up? Are you getting ready to retire and you want to travel the world? So if you want a way that you can learn to facilitate the process of reducing and eliminating your diabetes, you need to take action now. So click the link below, enter your information, and get access to my workshop, and let me help you.